everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very important topic, which is the medical asepsis. So what is medical asepsis? Medical asepsis is defined as the measures which is used in order to control and prevent the spread of microorganism from place to place or even from one person to the other. By following the medical asepsis, it helps us, especially the healthcare professionals, to protect ourselves from various microorganisms which will be present in the body of the patient, because here we are the ones who will be constantly providing care to them. So in order to protect ourselves from these microorganisms and in order to protect ourselves from suffering from any kinds of infections or conditions, it is very important that we must follow the medical asepsis. During daily routine care, we nurses follow this basic medical asepsis in order to break the chain of infection. Why? Because these infections can be spread from one person to the other. Here, for example, when you go and provide care to one patient, those pathogens which are present in the body of that particular patient may be transmitted to you when you come in contact with the body, and when you go and provide care to the other patient as well, it will be transmitted from you to them, and so on and so forth, right? So in order to break this chain of infection, it is very important that we nurses follow this basic medical asepsis before and after we provide care for any patient. Some common examples include hand washing, changing the bed linens of the client daily, as well as following the barrier technique. So here, when any client is being diagnosed with any infectious or communicable disease, it is very important that we must isolate those patients, and not only that, but we must also carry out various barrier techniques such as wearing masks, wearing gloves, wearing aprons whenever we provide care to them, and also whichever equipment, whichever articles which we are using for them must be first disinfected before it is used for the other patient. Why? Because here the environment in which this client will be in, the clothings which they will be using may also be contaminated with these pathogens, and if they are not properly sterilized and disinfected, then it can also spread these microorganisms, right? So in order to prevent the spreading of these microorganisms, what we do is we follow this barrier technique. So this is what medical asepsis is. So next, moving on to the cornerstone of medical asepsis. So here it is very important for us to know what is dirty, what is clean, what is sterile, which conditions that the client is suffering should be separated from the other clients. So here, for example, if the client is suffering from any communicable diseases, then we must make sure that we separate them from the rest, right? Because these are the diseases which can be easily transmitted from one person to the other through the air, through the water, through the droplet, and various other modes, right? So in order to prevent this transmission of infection, we should know which conditions are to be separated from the rest. And we should also know what are the various equipments and materials which we are using for the client, which needs to be decontaminated before they are being reused for the other clients as well. So these are the cornerstone of the medical asepsis. So here the essential component in order to maintain this medical asepsis include hand washing, utilizing of gloves, masks and gowns, cleaning and disinfecting of the materials or equipments which was used by the patient before they are being reused. And the last one is handling linen in ways to prevent the spread of these microorganisms. So these are the various components of medical asepsis. Now moving on to the next, that is the methods of medical asepsis. So here we will be discussing about what are the various methods which we can adopt in order to follow this medical asepsis and in order to prevent the spread of microorganisms from place to place or from one person to the other. The first one is the isolation of patients. So here, as I've repeatedly been saying, that whenever a patient is suffering from any infectious diseases or from any communicable diseases, it is very important that we must isolate that patient, because these are the conditions which can be easily transmitted from one person to the other through various modes of transmission. In order to prevent these from getting transmitted, we should make sure that we isolate the patient suffering from any infectious diseases. The second is hand washing. So here we will be discussing in detail in my next session about what medical hand washing is, and what are the various steps that you need to follow when you are performing this medical hand washing. Here, this medical hand washing is very important for us nurses to perform every time before and after we provide care to the client, because in this manner we will be washing away all the pathogens, all the microorganisms which are present in our hands, and through this manner it will also prevent the spread of these microorganisms from one person to the other, or even from yourself to the patient whenever you are providing care to them. The next one is preventive vaccination. So here, as a nurse, it is very important that we must educate the client, the family members, as well as the community about the various vaccinations which are readily available, which they can take in order to make themselves immune from various kinds of disease condition. The next is increasing the awareness among the visitors and the relatives. This is especially applicable if the client is suffering from any infectious diseases, since these are the diseases which can easily spread from one person to the other. So here it is very important that we must increase the awareness about how these diseases can easily be transmitted from one person to the other, especially for the visitors and the relatives, because here is very important that we must make sure that they protect themselves from these microorganisms by following the various medical asepsis techniques, such as hand washing, wearing masks, or even sitting at a distance which is not so close to the patient. So here, as a nurse, it is also very important that whenever you are providing care to these kind of patient, you should make sure that you wear your mask, your gown, and your glove in order to protect yourself. And you should also make sure that you make a good use of the chemical agents which is present in order to disinfect and clean all the equipments which was provided to them, as well as the unit after they are being discharged. So these are the various methods of medical asepsis which you can follow in order to prevent the spread of microorganism. So next, moving on to the procedure for applying the medical asepsis. So here, as we know that hospital is a place whereby many microorganisms will be present, right? So here it is very common that one may suffer from hospital-acquired infections, or commonly known as the nosocomial infection. So here, in order to reduce the cases of these hospital-acquired infections, it is very important that we must follow, as well as we must educate our other healthcare professionals and the family members, the patient and the visitors to follow the medical asepsis technique. So here the following steps outline the basic procedures which can be used in applying the medical asepsis, and these include performing the patient care hand wash, which is hand washing before and after performing any procedure. Disinfecting the materials as required, which I've been repeatedly saying that all the materials which has been used by the patient must be disinfected and sterilized. Maintaining clean patient care environment, use of clean and dirty utility rooms, storing and handling the linens properly, storing and handling the equipments and supplies properly, proper disposal of waste materials following the isolation technique for patients with communicable diseases, and the other considerations. So these are the various steps which outline the basic procedures used in applying the medical asepsis. So in order to get a clear idea of each and every step, let us discuss about it in detail. So the first one is performing the patient care hand washing. Here, as I've been repeatedly saying, that performing hand washing is very, very important. You should always wash your hands before and after you provide care to any patient, because in this manner, it will help to control as well as prevent the spread of these microorganisms from one person to the other. And by saying hand washing, it does not simply mean that you can just wash your hands in any manner you want, but whenever you perform this medical hand washing, there are certain steps that you need to follow. And in order to get a clear idea of what these steps are, we will be discussing in my next session in detail about the medical hand washing, where I will be teaching you what is medical hand washing, what is the purpose, what are the 7 steps, as well as we will be discussing about the procedure of medical hand washing in detail. So here it is very important that this hand washing must always be done not just by you, but also you must educate the client and the family members about following this medical hand washing. And the second one is disinfecting the materials as required. So here it is very important that you must always disinfect each and every materials which you have used in order to provide care to the patient, because whenever you use it for the patient, those microorganisms, those pathogens may be present in it, and if it is not properly sterilized or disinfected, then it can easily be transmitted from one person to the other. And when you are disinfecting the materials, you can use various chemical agents which will be present in the hospital in order to clean these materials. And when doing this, you can make use of all the chemical agents which is present in the hospital and which is specially designed in order to clean these materials. And the next one is maintaining a clean patient care environment. So here it is very important that whenever the patient is in the hospital, the environment which he is in must always be neat and tidy. It must be clean. There must be a proper ventilation, and also fumigation can be done once he or she has been discharged from the hospital, before that particular bed, before that particular unit is being given to another patient. Here you can also perform the concurrent cleaning or the terminal cleaning, where concurrent cleaning means disinfecting and disposing of the infected materials immediately during the course of a disease. So this here is a constant task. Whichever materials is present which needs to be discarded, whichever equipment you have used for the client that needs to be discarded, you should make sure that you do it immediately so that it will prevent the spread of microorganism. So these tasks which you do at that particular moment itself is known as the concurrent cleaning, whereas the terminal cleaning is the process whereby all the materials which has been used for the patient will be disinfected once he or she is discharged, or if they had been transferred to another hospital. So here any cleaning which is done at that particular moment is known as the concurrent cleaning, whereas any cleaning or disinfection which is done after the client is being discharged or transferred from the hospital, this is known as the terminal cleaning. And here, once the patient is being discharged from the hospital, before you occupy that bed, and here, once the patient is being discharged from the hospital, before you assign that bed to any other patient, you should make sure that you clean the furniture, the mattress, the bed linens must be changed. The mattress cover must be clean, and also those equipments which will not be handled at the central supply must be clean, right? And how can you do this? You can do this by using a freshly prepared germicidal detergent solution. So by the use of this solution, you can clean all the furnitures, all the mattress, all the equipments which cannot be used or which cannot be handled by the central supply, as well as you can dust the mattress cover and the table which was used by the patient during their hospital stay. The floor of that particular unit should also be mopped. And if it is the isolation room, then we must make sure that we read the isolation technique sign and follow the instruction as it is given there. So here it is very important that whenever the patient is in the hospital, we must provide a clean environment, as well as even after that particular patient is being discharged or transferred from the hospital, we must clean that particular unit before that unit is being assigned to any other patient. And the next one is using a clean and dirty utility room. So here the clean and the dirty materials equipments will never be kept in the same room. They will be separated in order to prevent the spread of microorganisms and in order to prevent the clean materials or the clean equipments from getting contaminated. These clean rooms are the rooms where all the clean and the unused equipments will be present, whereas the dirty utility rooms are the ones where all the contaminated linens, equipment and the trash will be present. So here we can understand, right? Clean rooms are the ones where only the clean and the unused equipments will be present, and dirty room is the one where only the contaminated materials, equipments, the trash will be present. And the next one is storing and handling the linens properly. So here it is very important that the linens must always be stored and handled carefully in order to prevent the cross contamination. Here clean linen must be stored in a clean room which is marked for the clean linen only, and we can prevent the contamination of these clean linen by limiting the access to these clean linens only to those only to those personnel who are authorized to do so, by washing hands before and after handling these linens, by keeping the linen from touching the floor or touching any other dirty surfaces, and also by keeping the linen from touching the uniform. So in this manner, these clean linens will be properly stored and handled. Now, when we talk about the dirty linens, here we must make sure that these dirty linens which has been contaminated by the blood, the body fluid, the secretion or the excretions of the patient must be stored in the dirty utility room. And here we can also prevent the spread of these microorganisms by following the various rules. The first one is by not shaking or tossing the dirty linens. The second is by not allowing these dirty linens to come in contact with our uniform. The third is by removing the dirty linens from the area using procedures which is established by the local standard operating procedures. So here we must always make sure that we store the clean and the dirty linen separately. And any equipment which has been used by the patient, we must make sure that we properly clean and disinfect it before placing it with the clean equipment so that it will be reused for the other patient. And whenever it is possible, we must make sure that we use the disposable equipments, and we must always make sure that we use a separate disposable items for each and every patient. So this is how you can store and handle the equipment supplies properly in the hospital. The next one is disposing of waste materials. So here the waste which will be produced in the hospitals will either be contaminated waste or the uncontaminated waste, right? So here if the waste are uncontaminated, that is if it is a general waste, then here no special precautions need to be taken. Here we can simply discard of these waste in the black bags, whereas if the waste is contaminated with the blood, the body fluids, the secretion or the excretions of the patient, then we must make sure that we handle it with special care, and we must also make sure that we discard it in the correct bin. Because here, since we have discussed about the biomedical waste management, we've come to know that each and every waste should be discarded in their own colored bags, right? Here there is the yellow bag, the red bag, the blue, the white and the black. So here if the waste are infected, we must make sure that we discard it in the proper bag. We must also seal each bag according to the local SOP before we removed it from the patient bedside. And we must place each bag in the specific area or container designated and labeled as contaminated trash. And here we should also remove each bag and container immediately from the ward or clinic as mentioned in the local SOP. And when we talk about excretions, here, if the client is bedridden, he or she will not be able to use the washroom, right? So here you will be providing bedpans for the client. So here, these materials or these equipments which contain the excretions of the client must be cleaned after each and every use. We must flush away all the contents promptly unless specimens are required. And whenever you carry this bedpan from the patient room to the other area, you can also cover it with the paper cover whenever it is necessary. And the last one here is the other considerations. So here, the standards liquid, which can also include the medications, must always be changed every 24 hours unless it is directed by the physician. So as a nurse, we must make sure that when we are providing these standard liquids, we should mention the time and the date of the time of change, because in this manner, as I've said, that we need to change it every 24 hours unless it is indicated by the physician. Then by mentioning the time and date, we will get an idea of how many hours has it been and when do we need to change it. And as we know that in a hospital, we also use the refrigerators whereby we can store the medications as well as the samples of the patient. So here it is very important that we must clean and also check the temperature of the refrigerators according to the local SOP. And here we must also make sure that the contents which is present in the refrigerator must be properly labeled and dated. So these are the various steps that outline the basic procedure used in applying the medical asepsis. So now here we have come to the end of this topic. In today's session, we have discussed about the medical asepsis. We have come to know what are the cornerstone of medical asepsis, what are the components, what are the methods of medical asepsis, as well as the various procedures which we can perform in order to apply this medical asepsis. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session whereby we will be discussing about the medical hand washing in detail. So until then, have a good day. Thank you.